Nursing associates. I said I was going to do it, so here it is. In this video, I'm going to talk about nursing associates, what they are, how to become one, what the role involves, difference between nursing associates and healthcare assistants, and the difference between nursing associates and registered nurses, why the role was introduced. Then I'm going to talk briefly a bit about my opinion, what I think the nursing future is. I'm going to talk briefly about nursing education and things like that. Hopefully this video is less than 7 minutes long. If I am talking very fast in the video, make sure you click on the setting box and reduce the speed. I'm sure this video is going to leave you guys with a whole load of new information, so make sure you share it with other people who you think will find it helpful and who you think will find it informative. And I'm also sure that this video is also going to leave you with a lot to think about. So Nursing Associates 101, who, what, when, where, how and why. Nursing Associates is a role that was developed in 2015 by Health Education England in order to bridge the gap between registered nurses and healthcare assistants. Nursing Associate, the role is very similar to that of a registered nurse, and the role includes delivering, assessing, implementing, evaluating care, assisting patients with their activities of daily living, and administering a whole wide range of oral medications, and also taking part in clinical skills such as venipuncture, which is basically taking blood from a patient, and cannulation, which is basically inserting a catheter into patient's venous system and basically preparing them for IV drug administration. From what I've seen out in practice and from what I've heard from discussions with other members who are working in the healthcare industry, the main difference between nursing associates and registered nurses is that nursing associates won't be able to complete the initial assessment of the patient. Another difference is that nursing associates will not be able to they won't be able to deliver IM drugs, so intramuscular drugs, and they also won't be able to deliver intravenous drugs. However, trusts can develop their own package to skill nursing associates up to this. One similarity between nursing associates and registered nurses is that they'll both be required to sign on with the NMC, and they'll have to go through the same revalidation process. Nursing associates are employed by the trust, and they undergo generic training in surgery, mental health, learning disability, medicine, community, and in hospitals. So obviously you'll spend a mixture of your time at your practice placement, and you'll also spend some of your time at the associated college. At the end of the 2-year degree, you'll finish with a foundation degree. You'll be employed at band 4, and you'll be making, I think, roughly anything from like £15,000 to £16,000, but obviously that will vary depending on what part of the country you make, with nursing associates in London making more than, I don't know, say for example nursing associates in York or in Leeds or in Manchester or even in Birmingham. The course is paid by an apprenticeship levy. So one benefit of going onto the nursing associate program is that you're employed by the trust. So while you are learning and while you're working your way up from a healthcare assistant to becoming a nursing associate, you are being paid by the trust. Another benefit of this is that your tuition fees are paid for, in a sense, by the apprenticeship levy. So you're making money, your tuition fees are being paid for, so you don't have to run the risk of leaving your job, going to university for a 3-year degree, being a broke student like most people are, and then coming out and finding a job. Everything is, in a sense, is paid for, which I think would be really beneficial for people who have a lot of financial responsibilities, or people who are unable to simply stop what they're doing, go to uni for 3 years, and not make as much money as they usually make. Another benefit of the nursing associate program is that it's generic, so you undergo placements in learning disability, in adult, in mental health, in surgery, in medicine. So when you finish your foundation degree, you're not an adult nursing associate or a mental health nursing associate, so you can work in a wide variety of places. You could work as a nursing associate on an assessment unit, which caters mostly to adults, and then if you decide, oh, this isn't for you, you can then go on and work as a nursing associate in a mental health setting. Whereas for me, as registered nurses, I've just been educated to work with, in the UK anyway, I've just been educated to work with adults, with adult patients. So I couldn't just be like, oh, I'm interested in working with mental health patients. I couldn't just go to a mental health facility and be like, oh, I'm going to work as a mental health nurse. If I want to do that, I have to do additional training, which I believe is about a year and a half to 2 years to do that. Whereas for nursing associates, you don't have to do that. One benefit of the nursing associate is that if you do become a nursing associate and decide, oh, actually, I do really want to become a nurse, you can take additional credits over a period of a minimum of 12 months and then work your way up to a band 5, which I think is a really good thing. And I just feel like it gives you more control when you don't run the risk of being like, oh, I'm going to start my 3-year degree, and then you could fail second year, because that happens to a lot of people. They fail first year, they fail second year, and then the whole degree has gone to waste. Whereas for the associate program, you start off as a healthcare assistant, you do the 2 years, and that's one stage completely done, and then you can do the extra year to become a nurse. Obviously, there's always going to be a risk. In terms of differences between the 3-year undergraduate nursing degree to become a registered nurse and the 2-year foundation degree to become a nursing associate, I feel like the nursing associate program places more responsibilities, or gives more responsibilities to NHS Trust to make sure that they educate the nursing associates to an adequate level, whereas the 3-year undergraduate degree to become a registered nurse places more emphasis on the university to obviously educate the student to become a successful and an adequate registered nurse once they qualify. Some people have said that this is going back to the old style of nursing, where nursing students were part of a nursing school within a hospital, rather than the new style of nursing, which I experienced and which a lot of people, I assume, are watching this video are currently experiencing, where you're part of a university. If you want a bit more information on this topic, make sure you visit my website, mariaavi.com. I will have a blog post on there which supports a lot of what I have said in this video. What I see for the future of nursing, I do believe nursing associates will dominate the nursing workforce, not in a sense that their numbers are going to be more than the numbers of registered nurses, but in a sense that their impact is going to have, their numbers or their presence is going to have a massive impact on the structure of nursing in the UK. I've read a lot of publications that say that nursing associates won't take over the role of registered nurses, but there is already at least one trust that I'm aware of in the UK that has agreed to cutting the number of registered nurses so that they can employ more nursing associates. Why? One, because they're cheaper to train or they're cheaper to educate, and two, because they are cheaper to maintain. So you can start to see why I titled this video Nursing Associates Cheap Substitute for Nurses. I didn't do it to be mean, I didn't do it to be nasty. It is what it is. It's fact, it's fact, it's fact. You can't run away from that. I can see what Health Education England is trying to do. I believe that they're trying to make not just the nursing structure, but nursing education mirror that of Canada and of Australia, which many of folks have argued is way better than the British way of educating nurses and the British structure of nursing. I kind of have to agree. What does the introduction of nursing associates into the nursing structure in the UK mean for Band 5 registered nurses like myself? For me, I believe that, this is just my opinion, it's not a true fact, but I just believe that it will kind of force Band 5 registered nurses to become more specialist nurses and to become more senior nurses. Why do you say force? You know, nursing is that sort of profession where it's a career where you're learning all the time. So if you stay in a profession long enough, and if you want it badly enough, you will move through the ranks. You will move through Band 5, Band 6, Band 7, and so on and so on. But the reason why I say force is because obviously to progress from a Band 5 to a Band 6, from a Band 6 to a Band 7 and so on, you have to have some form of formal education. Learning and development, the funding for that has been cut in pretty much every single NHS trust in the UK. So it's likely that in order to kind of maintain your, I don't know, oh, my hair is wet, sorry, I'm just drying it. But I just feel like there's going to be more of a soft pressure placed on Band 5 registered nurses to move through the ranks quicker, but there won't be as much educational support in terms of, well, there won't be as much financial support for education in order to do that. It's going to be a case of, oh, you're a Band 5 now. Oh, if you want to progress to a Band 6, then we'll give you a loan for £9,000 to go onto this course part-time at university, and you'll still be employed by the trust. But once you finish this £9,000 course, you're going to have to pay us back, and you're going to have to work at this trust for like the next 5 years. That's what I think it's going to be like. So I don't say force to be like, oh yeah, you're going to have to be a Band 5, but I just say force in the terms of there's going to be a lot of soft pressure to move through the ranks at a quicker rate. However, there may not be the support, the financial support that was there in the past. Yeah. I hope that makes sense. When I talk of soft pressure to go through the nursing ranks very quickly, just simply go on NHS Jobs UK, look for Band 5 registered nurses, and you will see at least 60%, if not 100% of the job openings for Band 5 registered nurses will have some sort of mention of, oh, come to our university, come to our hospital and you'll become a Band 6 within 2 or 3 years. If you come here, you'll start on this preceptorship program and we'll put you on level 6 and level 7 master's level studies to help you progress through the nursing rank quicker, and so you can become a senior nurse very quickly. This is so early on in the introduction of nursing associates. Like the nursing associate pilot scheme, it didn't finish long ago, and I'm pretty sure that there are some hospitals or there are some people who work in the NHS who have never seen, who have never heard of, or who have never even worked with a nursing associate. But I feel like I can already kind of see the impact that their introduction is having, which I think is, I don't know, there's benefits and there's disadvantages to it. Some of the hospitals in York were part of the pilot scheme for nursing associates. So I've seen nursing associates out in practice, and it can work. It can actually work. It's just a case of making sure that there's policies and procedures with every profession in the nursing, with every sort of program in the nursing, is making sure that it's implemented nationally, not that one trust has this policy and one trust has that policy, which now that I've started working as a Band 5 registered nurse, I can see that there's so much discrepancy between what's done here and what's done here and what's done here, and I'm pretty sure the nursing associate program is going to experience the same issue, but we can't just put that as a nursing associate problem. That's kind of a problem for I think, nursing structure in the whole of the UK. You know, a nurse could be working as a nurse at Cherry Hill Trust for 15 years. She's been doing venipuncture. She's been doing cannulation. She's been setting up NIVs. She's been doing all of this sort of stuff. And as soon as she decides that she wants to go over to Cherry Cake Trust, she has to do all of that training again just so she can get onto the, I know people say so they can get onto the insurance policy, but there's just a lot of, I don't know. But I hope you know what I meant when I talked about soft pressure. Anyway. Like I said earlier, make sure you visit my website, mariaavi.com. A link for that will be in the description box, where I will go into a bit more detail about the things that I've already mentioned in this video. Hopefully reading things for some people will make more sense, because I know some people like to hear, some people like to read, some people like to actually do it. So I'm just trying to go into as many forms of the senses so more people can understand what it is that I'm trying to say. So, concerns about care. I don't really understand why. Well, I do understand why people would be concerned about the quality of care, because we are getting people who have been educated to a lower level to care for the same type of patient. We know every year patients are getting sicker and sicker and sicker. People are living for longer with more comorbidity. So how are we supposed to support an aging and an older and a sicker population with people who have a lower education or less competencies? I kind of understand that, but at the same time, I think regardless of the introduction of nursing associates, you should still be concerned about the quality of care. The current registered nursing levels in the UK is not enough. It's not enough. So whether nursing associates are here or not, you should still be concerned. I've seen Band 2 healthcare assistants give good quality care. I've seen Band 3 healthcare assistants give good quality care. I've seen Band 4, Band 5, Band 6, every single range, every single band, every single range of nursing give fantastic, good quality care. As long as there's policies and procedures in place, and as long as these are implemented and that we are put in the right environment, then there should be no issue. But the current issue now is that there's simply not enough. There's simply not enough nurses. There's not enough people working in healthcare, and the environment isn't always best. When I say environment, I mean the whole ergonomics of how it works. But saying that, the NHS, I believe, is still one of the most efficient healthcare systems in the whole entire universe, and it is literally run off the back of nurses. There's a reason why, the nursing profession never goes on strike, because if we were to go on strike, the world would literally stop. One thing I would like to know is if the retention of nursing associates is going to be better or worse than the retention of Band 5 registered nurses. Obviously, we're going to have to wait like a couple of years to, get the facts and figures. But personally, at this point, I think that the retention of nursing associates is going to be better than the retention for Band 5 registered nurses. And the main reason why I believe this to be the case is because people generally who are accepted onto the nursing associate program have already worked as healthcare assistants. They know how the NHS works. Like, they have a better understanding of the nursing role and what it involves. Whereas people who are accepted onto the 3-year undergraduate degree, they may not have had any healthcare experience. I know that when I started my nursing degree at uni, before that, I'd never been in a hospital. The only time I'd ever been in hospital was literally on my way out after being birthed. So you can imagine like a lot of 18, 19-year-olds who they know they want to be a nurse, but they don't really know what the role involves, in comparison to someone who's worked as a healthcare assistant for 1, 2, 3, 4 years. They know what the nursing role involves. So I definitely believe that the retention of nursing associates is going to be better. Another thing I want to know in terms of nursing associate and this whole Brexit climate, are we leaving, are we staying? I want to know how the role of the nursing associate is going to, what impact is it going to have on the recruitment of international nurses. This might not be really relevant if you work outside of London. I know I did most of my training up north, and I probably met like 1 or 2 international nurses in my whole 4-year undergraduate master of nursing degree. But now that I work in London, like pretty much at least like 30% of the nurses who work on the ward where I'm employed at, they're international nurses. And if there's already trusts in the NHS that have agreed to cutting down the number of Band 5 registered nurses to employ more Band 4 nursing associates, what impact is it going to have on the recruitment of international nurses? It's hard to say. You could say that the recruitment of international nurses is going to go down because it's cheaper. It really depends on the money thing. Is it cheaper to recruit international nurses, or is it cheaper to educate people to become Band 4 nursing associates and then upskill them to pretty much the same level as a Band 5 registered nurse? It's a weird one. Another thing I want to know is there a similar program or is there a similar structure in other countries within the EU? This is raised kind of from the Brexit and the whole Brexit thing that's happening. Like, could someone become a nursing associate here and be like, oh, I want to go to Spain and I want to work as a nursing associate here? Or are they just limited to working as a nursing associate in the UK? I feel like nursing is such a massive workforce when you include healthcare assistants, when you include nurses, when you include, you know, the new nursing associates. It's such a massive profession that I feel like the UK is kind of selling themselves short if nursing associates won't have that opportunity to work elsewhere in the EU. I know some people might not see it as a big deal, and it may not be a big deal. It could just be me overthinking it, but I just feel like movement of such a large profession is very, very, very important. Anyway, like I said, make sure you visit my website, mariaivy.com. Hopefully I can clarify a lot of what I've said in this video over there. I do believe it can work if there are structures and policies that will be implemented nationally. Unless you're generally not interested, then don't do it. Like, if it's something you're passionate about, if it's something you're interested in, then go ahead and do it. But anyway, make sure you give this video a thumbs up. Make sure you comment, please, guys. I'm genuinely interested in hearing your thoughts, your opinion, your understanding of this topic. So please comment in the comments box below. Subscribe if you want more videos like this. If you have any other video suggestions, let me know, because like I'm genuinely interested in this topic. Anyway, thank you guys for watching, and I'll see you guys in my next video. Bye.